If your dog was diagnosed with medial shoulder instability, and you want to know more about this condition, treatments, and long-term outcomes, then this video should be helpful. If your dog is showing signs of forelimb lameness, and either you haven't been to the vet yet, or they weren't able to provide an official diagnosis, then this video may help you identify if some of these symptoms relate to your dog. Medial means inside, so this condition is instability on the inside of the shoulder in the dog. Here we have 3 drawings of the 3 main structures implicated in medial shoulder instability: the subscapularis tendon, the medial glenohumeral ligament, and the joint capsule. Some dogs are more susceptible to this injury than others, either due to their genetics or the nature of their job and activities. Poodles, for example, are a breed that seem to be genetically prone to this condition, but most dogs will be working or agility dogs, typically around 4 to 5 years old. Dogs that work hard and run hard, pushing these fairly weak structures to their limits and beyond. If your dog suffered a traumatic injury, this would probably be quite obvious. A sudden, injurious event leading to pretty serious symptoms, most likely including lameness on the affected limb. Most injuries, however, will be chronic. The supporting structures here, on the inside of the shoulder, will be consistently pushed near their limit during the course of regular activities. Then one day, when these structures are put under just a little too much load, perhaps while the dog is doing agility exercises like weave pulls, jumping off the couch, or a minor slip on the floor, they'll finally give out and fail. But whether the injury is traumatic or chronic, either way, the injury is from excessive abduction, the forelimb moving out to the side, too far away from the body. In medial shoulder instability, it's the medial glenohumeral ligament here, the subscapularis tendon, and or the joint capsule that is injured. Injury to these structures could be mild, resulting in laxity, meaning looseness. Moderate injuries could include partial tears to one or all of these structures. Severe injuries could include full tears to some of these structures. And very severe injuries could result in full tears to all of these structures, resulting in luxation of the humeral head. That's when the head of the arm bone here moves out of place. I have a full-length video on medial shoulder instability on my anatomy channel, so if you want to know more about these structures, check out that video. The link is in the description. To assess your dog, your vet will typically use a combination of palpation and imaging. The main physical assessment is to test shoulder abduction. Does the arm move too far out to the side of the dog's body? If the inside shoulder tendons and ligaments are damaged, often the dog's arm will move too far into abduction. When assessing via palpation, they will also look for pain, muscle spasms and guarding, and limited range of motion in other directions, especially shoulder extension, where the arm moves in front of the body. But a palpation test isn't 100%, especially if the injury is mild to moderate. Your dog may be able to compensate and hide their injury. Ultrasound and MRI are both possible imaging options, but MRI is very expensive and requires full sedation, so it won't typically be used for this type of injury. Ultrasound generally doesn't require full sedation, or sometimes any sedation at all, and most clinics will be able to do it in-house. However, due to its location, it can be hard to look at the inside of the shoulder, especially if your dog is a little overweight. So arthroscopy is the preferred method. It will only require a small hole to take a look in and around the joint to fully assess potential damage. X-ray and CT scans may also be used, not to diagnose medial shoulder instability, but to rule out other conditions that could be causing the symptoms that you and your vet are seeing. Most studies indicate that conservative treatment is equally effective to surgery, unless the injury is very severe. If the structures on the inside of the shoulder are fully torn, the articular cartilage here is wearing, which increases the risk of developing osteoarthritis, or the head of the humerus, the arm bone, is luxating out of the shoulder joint, then these are severe injuries that your vet might recommend surgery. Otherwise, usually conservative treatments like rehab, pain management, massage, pulsed electromagnetic frequency, laser, red light, neuromuscular electrical stimulation for muscle atrophy, platelet-rich plasma, stem cells, and others could be implemented. Then, after a period of time, say 3 months, they could retest for pain and shoulder laxity and see what progress, if any, has been made. Radiofrequency-induced capsulorrhaphy is an intermediate option that is done arthroscopically. Laxity and partial tears are treated using heat to shrink and tighten them. This won't work if tendons or ligaments are fully torn, because shrinking 2 ends of a cut rope isn't going to reattach them. Overall outcomes are pretty good, but not clearly superior to non-surgical rehab. Medial shoulder instability, particularly mild medial shoulder instability, can be difficult to identify and diagnose. But diagnosis matters, especially for preventing degenerative conditions like osteoarthritis that could result if this injury goes untreated. So I'd encourage you to follow your vet's direction and do what is necessary in the diagnostic process to figure out exactly what is going on in your dog's shoulder. If your vet doesn't have the correct equipment, this might require seeing a specialist who can perform all the necessary tests. And then you can work together to figure out a treatment plan that meets your dog's specific needs. Again, if you want more information, check out my full-length anatomy video on this subject. Thanks for watching.